continue your tweeting. Don't mean to interrupt. So what comes to mind when you think of technological innovation in healthcare? If you're here and you're fortunate enough to live in the United States or a developed land, you might think it's a piece of wearable technology, one that counts our steps and tracks our heart rate. Maybe it's a state-of-the-art imaging machine that can detect illness earlier. But what about those not quite as fortunate? What about those living in Africa, a place where more than 1 million newborns die each year from what are mostly preventable causes? Preventable, but only if life-saving technologies, many of which we take for granted, are available. Our next finalist team has been working together to develop life-saving technologies for 10 years. Welcome Rice 360 Institute for Global Health. Dr. Queen Dube from the University of Malawi, Rebecca Richards-Kortum from Rice University, Robert Miros from Third Stone Design, and Joy Lawn from the London School of Hygiene and Tropical Medicine.
Every year in Africa, 1.1 million newborn babies die. Most of these deaths could be easily prevented, but existing life-saving tools are too expensive or break down in the harsh conditions of African hospitals.
That's why we created Nest, a special portfolio of newborn essential solutions and technologies designed specifically to work in Africa to be effective, affordable, and sustainable.
With 100&Change, we will complete the innovations to Nest. We will distribute Nest to hospitals across Africa, and we will continually measure its impact to improve results.
1.1 million newborns died in Africa this year. That's why your investment is needed in Nest now.
My name is Queen Dube. I'm a pediatrician working in Malawi. I look after newborn babies. Every day I go to work, I see babies die. And the most painful bit for a doctor is actually knowing that you could have saved those lives if you had the tools to enable you to do so. Sadly, what I see in my hospital is happening all across Africa. So every year in Africa, we lose 1.1 million newborns. The heartbreak is, ladies and gentlemen, 75% of those deaths are actually preventable. Preventable with technologies that have been available in the United States for over 50 years. What actually kills these newborns hasn't changed over the past 100 years. It's either they are born too early, they have an infection on board, or they suffer from some birth-related trauma. My hospital back home, every year, around about June, July, we receive a container full of donated equipment. It's a joyful moment. But the equipment fails. It doesn't save the babies, because the devices are not tailor-made to withstand the harsh African environments, the heat, the dust, the frequent power outages, and we don't have the spare parts to fix the technologies. So the equipment ends up in the equipment graveyard. This is a picture of the equipment graveyard in my hospital. At the end of my long shift, I go there and I pay my respects. These technologies, donated technologies, they don't save the babies they're supposed to save. What Africa needs is a solution. Africa needs technologies that are effective, technologies that are affordable, technologies that are sustainable, equipment that doesn't just break down. And that's what this team, the NEST team, is all about. NEST standing for Newborn Essential Solutions and Technologies. As a team, we've developed a package of 17 technologies, a package that addresses are the three major killers of a newborn. Addresses nutrition, infection, birth-related trauma, jaundice. The baby you see in the middle is on breathing support. On top of us supporting their breathing, they need to be kept warm. They need to feed. If they have an infection on board, an African doctor should be able to treat them. And that's what NEST is all about. What really excites me as an African is the cost of NEST, delivered at scale. Ladies and gentlemen, NEST as a package actually costs $1.48 per birth delivered at scale. But for us as a team to bring it to scale, we need a $100 million investment. NEST is ready to scale. 3 things that we're going to do as a team: innovate, complete the package, we'll distribute the package. First, in my home country, Malawi, home is best. Tanzania, Nigeria, the rest of Africa. What about Asia? Brazil, Nepal. We want NEST to be there. We want to measure the impact of NEST. How many lives are we going to save? As a team, we are more than ready to make sure that NEST is available, ensuring that these African newborns have a secure environment, closing the survival gap for Africa. We're in the SDG era, Sustainable Development Goals, where everybody says, leaving no one behind. And as a team, we are ready not to leave that African newborn behind. So many African newborns, 30 years from today, they share this stage. To tell you how we plan to build the NEST is the mama of the team, a great engineer, powerful innovator, who will take us through how we plan to build the NEST. Rebecca.
Thank you, Queen. When the 100&Change initiative came out, we knew it was our chance, together with Queen and her colleagues, to make sure that clinicians all across Africa have the tools they need to help babies survive. $100 million means the chance to solve this problem. It is within our grasp. Our solution has 3 parts. It begins with innovation. We will deliver the 17 life-saving innovations of the NEST package. We will partner with nursing schools, with medical schools, and with engineering schools to train the clinicians, the technicians, and the engineers who are dedicated to improving newborn survival. Hospitals in Africa, they need a simple way to order NEST. We will solve this problem by establishing a nonprofit distributor. By the end of 100&Change, this distributor will be financially sustainable, creating a permanent solution. Now, we know that we can't scale NEST without broad demand. We need demand from governments, from WHO, from UNICEF, and also from the private sector. Generating that demand requires rigorous evidence, and we will measure the number of lives that are saved by NEST and the cost to save those lives. And we will use that data to generate multi-country demand. How do we know that we can do this? Because we have already done it for the first NEST technology. I will never forget my first visit to Queen's Hospital in 2005. I saw many tiny babies like Chikanjetso, who you see here fighting to breathe. And Queen, she explained to me that half of babies who are born too soon, they struggle to breathe because their lungs are immature. And we know that without treatment, most of these babies will die. She also took me to the equipment graveyard at her hospital, and she explained why the breathing machines that are used in America do not work in her hospital. Now, I'm an engineering professor. My job is to teach students how to build new innovations to solve real problems. So we got to work. We got to work with Queen and her team, and we designed a breathing machine that was effective, that was affordable, and that was sustainable. And we have our first prototype here today, and I gotta tell you, when we showed that it delivered the same therapeutic flow and pressure as breathing machines used in the United States, we were so excited. And we got on a plane and we proudly took it to Queen and we showed it to her. And she told us everything that was wrong with it. She said, it's in a shoebox, it's too flimsy, it's gonna break. You have tubes coming out the front and tubes coming out the back. They need to be polarized, the buttons need pictorial icons. But she said, can we keep it? Can we use it to start treating our babies? And so we worked and we made all of the improvements that they requested. And we were so fortunate to receive one of the very first Saving Lives at Birth grants from USAID. And we worked with Queen to measure the impact of this technology. And we showed that for premature babies treated with this breathing device, survival went up by 40%. And that mirrors the improvement that was seen when this technology was introduced in the United States in the late 1960s. Together, we named the device Pumani. It's a Malawian word that means breathe restfully. And with this data in hand, we partnered with Malawi's Ministry of Health. We got more support from USAID. We got support from Elma Philanthropies. And we were able to roll Pumani out to every hospital in the country. And we trained nurses and doctors to use it. Today, Pumani is saving lives in every hospital in the country. It costs less than 1/10 the price of systems used in the United States. Pumani worked. It worked even in district hospitals. Instead of ending up in the graveyard, it is up in the newborn unit. We thought we were done. But in rolling Pumani out, we saw babies who were cold. We saw babies who had jaundice. And we met many clinicians who were frustrated. They didn't have the tools they needed to treat these conditions. And so we went back to work. Since 2006, our team has worked with hundreds of engineering students in the United States, in Malawi, and in Nigeria. And with support from the Lemelson Foundation and from the Fogarty Center, together, these students have created many other newborn technologies. That became the Nest. In assembling the Nest, we included not just our own innovations, but we looked at the medical marketplace to find the very best other innovations, and together put together a package that allowed Queen to have what she needs to treat those babies. Now, this afternoon, you will have a chance to come and see all 17 of those technologies in our breakout room. I am so excited for you to see it. It's awesome. Today, I only have a chance to tell you about 3. Left untreated, newborn jaundice can cause brain damage and death. District hospitals often don't have the tools they need to diagnose jaundice. This $150 reader can diagnose jaundice at the bedside in less than 2 minutes with 1 drop of blood for less than 5 cents per test. If a baby has jaundice, there's another tool in the Nest that they can immediately use to treat jaundice, these phototherapy lights. They are made by a nonprofit called DREV. They're commercially available, but they're not distributed in Africa. And so if Queen wants to order these lights, it costs more in shipping to get them to her hospital than the lights actually cost. Our nonprofit distributor will solve this problem. Finally, hypothermia is such a challenge for newborn babies in Africa. They're tiny, they lose heat so quickly, and we know for every 1 degree that their temperature drops, the chance they will die goes up by 28%. You can't tell by looking if a baby is too cold. This $50 reusable temperature monitor clips right onto the crib side, and with just a glance, a nurse can know if a baby is too cold and immediately intervene to warm them up. So are we ready to roll out these 17 technologies? The good news is that 8 of them are already commercially available. They are just not yet distributed in Africa, and our nonprofit distributor will solve this challenge. We have 4 more that are in successful multi-center clinical trials, and with investment from 100&Change, we will take them to products in 24 to 27 months. We will take working prototypes of the last 5 to products within 36 months. The power of value engineering is that these are simple technologies and the development timelines are predictable. Remember, each one of these technologies, it began with a team of students. Students who learned to use the process of innovation to solve a real problem. Students who had a chance to see their work have an impact on someone else's life. And I think these students, they are our most important product because they are what will keep the cycle of innovation going after 100&Change ends. With just $6 million, we took Pumani from a shoebox prototype to a medical product that is not used just in 37 hospitals in Malawi. It is saving newborn lives in 30 countries. With $100 million, we are ready. We are ready to deliver the 17 life-saving innovations of Nest. We are ready to solve the challenge of distributing medical products in Africa. And we are ready to measure the impact of this technology and use that data to drive uptake across Africa. We are ready to save hundreds of thousands of newborn lives every year. Now, to crack the distribution nut, we know we need the right partner, and we are so fortunate to be joined by Robert Miros. Robert shares our commitment to distribution at nonprofit rates so that these technologies are available to the poorest families. When I look back on the journey of Pumani, I know we could not have taken it from this shoebox to a medical product without Robert's partnership.
When I joined the Nest team in 2012, my company was already developing medical devices for global health applications. We specialize in product design and have a unique focus on bringing global health products to market. Our challenge with Pumani was to take that shoebox prototype and transform it into a real medical product. As you can see here, we took the concept through several stages in development and advanced it to a final successful design. In 2 years, we secured the CE mark and found the right manufacturing partner to produce the devices according to global quality standards. In 2015, we began selling the lowest cost, easiest to use, all-in-one breathing machine on the planet. Today, there are 1,000 Pumani machines in use and in production. And Pumani is saving newborn lives in 30 countries across the globe. We proved that we can go from a prototype to large-scale manufacture for a single medical device and offer it at an affordable price. So how do we replicate this success for the rest of the products in Nest? The challenge lies in the distribution system. For purposes of illustration, let me walk you through the costs involved in making, selling, and distributing one Pumani unit. The unit costs us $550 to manufacture. We sell it into the market for $800, leaving us $250 for sales, engineering, and regulatory costs. Then Pumani leaves a warehouse and gets on an airplane. When it lands in country, it goes through customs and regulatory clearances. Then we deliver it to a hospital where we conduct training for healthcare providers. And to assure long-term functionality, we provide service and technical support. And though it varies somewhat from country to country, these costs add up to about $750. So what started out as an affordable product with a reasonable margin in the beginning ends up with a $500 downstream loss every time one leaves our warehouse. This is where Nest comes in, though, and why it's so exciting. Though the cost of goods for the devices and the sales price is necessarily higher because we're offering an entire bundle of products, the relative distribution costs are much less. This is possible because the distribution activities involved for a breathing machine or a tool to diagnose jaundice or a temperature monitor are all essentially the same. So when we deliver all the devices together, and we conduct the training all together, and we send one service technician to service the whole suite, all in one visit, we effectively spread the costs over the whole suite, becoming sustainable in the process. So how are we going to achieve this? We start by distributing Nest in Malawi, Tanzania, and Nigeria. We set up distribution hubs in Tanzania and Nigeria, and from those places, we then reach the other 4 African countries that have pledged with UNICEF to cut newborn mortality in half in the next 5 years. These 7 countries account for 46% of the births in Africa, and we believe will bring us to a tipping point for the continent. This is the power of the 100&Change grant. It breaks through the initial barriers to effective distribution and allows for economies of scale for Nest, which allow the overall enterprise to become self-sustaining indefinitely. And perhaps even more important, we'll be establishing a functional market so that those future medical innovators that we're educating will have a place to take their products year after year and close that health equity gap in the next decade. Without 100&Change, we'll be stuck in a business as usual situation. One product at a time with incremental health benefits and high costs of distribution. With 100&Change, we'll build a sustainable distribution system that will allow us to deliver world-class medical products. And after 100&Change is spent, we'll have a financially sustainable way for Nest to achieve its long-term goal of saving 500,000 newborn lives per year. Now, as any of you in business know, just because you build it doesn't mean they will come. We will have to generate the demand and the global will to recommend and procure this life-saving technology. To drive this demand with measured results, I can think of no one better than Dr. Joy Lawn. If there's one leader that can be credited with shifting the international policy landscape for the care of newborns, it is Joy.
Thank you, Robert. Thank you, Robert. But what he didn't mention is that my true qualification for standing here today is that I should have been a newborn death. And I should have been a newborn death in the bush in northern Uganda. So this is where my family lived for 20 years. My mother had an obstructed labor. She was taken into this maternity home. No running water, no electricity. She was there overnight, and in the morning, they were able to find somebody who in fact had never done a cesarean section, hadn't been properly trained, but he was able to do a cesarean section. And that saved my life and my mother's life. So I'm standing here today in front of you because people stood up for me and stood up for my mother, because people spoke up for us. And I've spent the last 3 decades working on newborn survival and speaking up for mothers and their babies around the world, and particularly in Africa, as a medical doctor and as a professor of epidemiology. And I've personally seen hundreds of newborn deaths that should not have happened. And today, I'm wearing my Ghanaian funeral dress. And I'm wearing it because this year, 2017, 1.1 million newborn babies died in Africa, most of them preventable. Invisible, and yet something that we can and must change. And my job, and the job of our Nest team, is to stand up, to speak up for newborns, and to see that that changes. Well, that sounds great, but maybe we're just a bunch of dreamers. Is this actually possible, or is we are just hoping and wishing? And it is possible. It's possible because of 3 important shifts that mean we can do this now as never before. And the first is that we have powerful evidence about this situation. 99% of the world's newborn deaths actually happen in low and middle income countries, but it's only the last 15 years that we've started to pay attention to those 99% of deaths. We now know where and why those deaths happen. We know that 1/10 of the whole global burden of disease of all conditions all over the planet is actually related to newborn deaths. We have trials showing what we can do at community level with community health workers or with traditional birth attendants. And we know that we can do something, but without providing high-quality care in hospitals, we can't truly reduce death and also disability. Well, I used to think that if we published lots of papers, particularly if we managed to publish them in Lancet, and then we got WHO, never the fastest moving organization, but we managed to get lots of global guidelines, that the world would change. Well, about 200 papers and a whole heap of WHO guidelines later, I can tell you, necessary but not sufficient. Why? Because newborns weren't on people's political to-do list. We didn't have political will. So what's the second shift? Is that we do now have political will. In the new Sustainable Development Goals, just launched a couple of years ago, for the first time in history, we have a target that specifies newborn survival. Every country on this planet has to meet that target by the year 2030. So, the newborn has finally emerged on the global agenda. But it's really painful to me as an African, and to Queen, my sister African. We swapped outfits today. She's here in glamorous Gucci, maybe. I hope not. It's painful to me that Africa has the highest risk of newborn death and still the slowest progress. But the good news here again is that African leaders recognize this and they want to change that situation. 7 African countries have pledged to reduce hospital deaths by 50% in 5 years, ambitious target. And here today we're honored to have the Honorable Minister of Health from Nigeria, who's carrying the greatest weight of what needs to be done for Africa, for Africans' newborns. So, that's all very well, but what happens if we can't reach mothers and their newborns? We could have the evidence, we can have the political will, but we can't reach them. So the third shift is that the place of birth has changed. Now, 80% of the world's births happen in hospitals. Big recent shift into hospital wards that in many cases look like this. Poor quality of care, not the right equipment, things in the hospital graveyard, equipment graveyard, as Queen talked about earlier. An opportunity, but also a place maybe where if we fail, women and families will start going back to home instead of coming into hospital. So we need to change this. We have the opportunity, but something different needs to be done. So, never before have we had this opportunity. We have powerful evidence, we have political will, and we now have a place where we can reach women and their babies. And this gives us a platform where Nest now is able to come in and have that impact. But we can only drive that change if we're able to measure the impact and show cost effectiveness. And that's an important component of what the investment of 100&Change would bring. And with 100&Change, we will be able to measure that. So in Malawi, we will learn from what has already worked or not worked for scaling up the package of Nest. We'll move to Tanzania, where shockingly, the neonatal mortality rate is double that within Malawi. And we will measure cost and impact. And then we will work with the rest of these 4 countries in the United Nations network across Africa to pull the lever of larger scale change. Our team, as you have heard, has experts in innovation, in distribution, and in measurement. Our team is composed of unlike minds, slightly unlike accents as well, but with a common passion to change this situation. We are ready to do this, and we will do it together.
Ladies and gentlemen, this year, 1.1 million newborns died in Africa. We could have prevented most of those deaths, only if effective, affordable, and sustainable technologies were available in my continent, Africa.
We are ready to solve this problem by delivering the 17 effective, affordable, and sustainable tools of NEST. It gives clinicians the tools they need to treat and prevent the 3 leading causes of newborn death. And it can be delivered at scale for just $1.48 per birth.
With 100&Change, we will innovate to complete the nest. We will solve the tough problem of distributing medical devices in Africa, and we will measure the number of newborn lives saved by the nest.
Without NEST, if we continue business as usual, it's going to be 110 years before a baby born in Africa has the same chance as a baby born here in Chicago. But with NEST, we have the opportunity to close that survival gap, dramatically reducing deaths for newborns in Africa. Here is Chikonjetso. You met him earlier when he was 1 day old, struggling to breathe. Now he's 2, thriving, surviving, and kind of almost smiling. Chikonjetso means the conqueror. With NEST, hundreds of thousands of newborns would also have that opportunity to conquer, to survive, and to thrive. You and I are part of the first generation that can make this change. There are not many things left in global health which are a big problem, but also with big impact. We've got the tools. Our team is ready. African leaders are saying the time is now. With your support, we will deliver. Thank you.
Thanks to their presentation and their commitment to improving the survival rate for newborns in Africa. We're going to take our final brief break before hearing from our 4th finalist.